I'd like to call the January 8th meeting of the Advisory Committee on Accessibility and Inclusiveness to order, please. First off, we'll have the introduction of late items. Ms. Ricard.
Thank you, Madam Chair. We have several late items to add to the agenda, starting under heading 5, Council Communications, adding 5A, Local Community Accessibility Grant,
Do not disturb.
and adding 5B, 2024 Annual Report for the Akai Committee. Under the reports heading, adding 7E, verbal update regarding accessibility and inclusion events related to the Luminous Paths, Nanaimo's 150th and beyond. And adding report 7F, a verbal update regarding draft design for the Neck Point Park parking lot paving project. It's my understanding that our presenter, Dr. Adam Hoverman, agenda item 6A, is also not at the meeting at this time. So I would like to suggest that we reorder the agenda to consider the report 7A, Transportation 2025 Work Plan, prior to considering the presentation 6A. Thank you.
Yes, excellent. So if I could have a motion for the adoption of the agenda as amended. Moved by Alexandria, seconded by Sean.
Oh, Linda.
Oh, pardon me. Linda, I see your hand up. Okay, not a hand. Okay, I'll take it as a second of the motion. All in favor of the agenda as amended? Thank you, that carries. And then we have one set of minutes to adopt from our November 13th meeting. If I could have a motion for the adoption of those minutes, unless there's any changes people would like to make. Not seeing any hands, so moved by Sean and seconded by Alexandria. All in favor? And that carries. Thank you very much. Next up, under Council Communications, Ms. Ricard.
Thank you. We would just like to advise the committee today that arising from Council's November 18, 2024 regular meeting, Council adopted the committee's recommendation to provide a letter in support of the city's application for a local community accessibility grant to Spark BC in the amount of $24,052 for the purchase and installation of 7 assistive hearing devices for the wickets at the front counters at the 5 recreation centers. So just letting the committee know that the recommendation that was put forward by the committee previously has been endorsed. Second update is arising from December 16th regular council meeting regarding 2024 annual report for the committee. And council has adopted the report, which was presented by staff, providing an overview of the topics examined by the committee in 2024. Outlining the 2024 work plan accomplishments, trends, and issues of concerns, and future meeting topics. If the committee members are interested in reviewing the details of this report, it is available on the city's website for the December 16th regular council agenda. Thank you.
Thank you very much. So moving into our first report, this is our Transportation 2025 Work Plan. And this is going to be introduced by Jamie Rose, our Manager of Transportation.
Good afternoon. Thank you for having us, and Happy New Year to everybody. Battle & Co. has drafted a report with a bit of a preview of some of the work that we're planning to work on this year. And so I'm actually just going to quickly defer to Madeline to talk through, and we're happy to answer any questions that come about.
Hello, it's working. Thanks for having us here today. My name's Madeline. I'm the Active Transportation Project Specialist with the city. So my job is looking after projects related to walking, cycling, rolling, and how we can make that safer and more convenient for Nanaimo residents of all ages and abilities. We wanted to take the chance to come to your first meeting of the year today and talk through what we have on our work plan for 2025. We recognize that transportation projects can have serious implications for accessibility and inclusion, and we really appreciate the opportunity to be able to talk over this with this committee. So without further ado, I'm going to launch into our list of projects, which are also in the information report that you'll have First on the list, Norwell Drive project. So this is in the area around Country Club Mall. We will be renewing pavement, traffic signals, and utilities on Norwell Drive, and we'll also be planning changes to the Country Club Transit Exchange. So 2025 will really be focused on planning out that project, and construction will be happening in 2026, 2027. So the next list of projects are ones that are kind of ongoing or that we've already got a bit of a start on. Number one, end-of-trip cycling facilities. So this is a bit of a two-part project where council has committed funds for us to actually start building some secure bicycle parking in downtown Nanaimo and a couple of other priority locations. At the same time, we're going to be developing a bit of a strategy to build these out even further, like over a longer term. So we're looking at design of end-of-trip cycling facilities and secure bike parking, as well as a build-out strategy with how to select priority locations for that. Next project on the list is a parking study. So this parking study is looking citywide. It will be looking at things like our parking bylaw that looks at private development, but it's much more comprehensive than that, where we'll also be looking at parking on public property as well as what we're requiring from our private developers. And I know that accessible parking can be quite a hot topic, so there may be some interest from the committee on that one. Wayfinding. So this is something I know that the committee has recently heard from Charlotte Davis from Parks, Recreation and Culture about wayfinding at Westwood Lake specifically. There's going to be a lot of overlap with our department on that work as well, because we will also be looking at active transportation wayfinding across the transportation network. And we want to make sure that whatever we're doing in transportation is consistent with what we're doing in parks, at least as much as it makes sense. Next is our Vision Zero strategy. So the city's integrated action plan includes direction to work on a Vision Zero toolkit. And I'm not sure how familiar people are with the term Vision Zero. Basically, it means a strategy to eliminate all traffic fatalities and severe injuries while increasing safe, healthy, equitable mobility for all. So that's a project that we're going to be working on throughout 2025, is how we can develop a toolkit for Nanaimo to work on Vision Zero. Pedestrian unallocated, this one may ring a bell because it's something that we do every year. Council provides funding to the transportation group to make general pedestrian improvements throughout the city. Staff come to council partway through the year with a list of recommended projects, and council will approve those or amend the list. And one that was here in 2021, we actually focused that funding towards accessibility upgrades at bus stops. Communicating with the community is another project that is kind of ongoing. We're always looking at how we can more effectively and transparently communicate with the public, and I believe that later on the agenda, you're going to be hearing from our communications department on kind of how we're looking at that at the city level, and transportation is going to be closely involved with that. And Downtown Transit Hub is the last ongoing project. Downtown Transit Hub is being designed, and when complete, it will support active transportation connections between downtown, surrounding neighborhoods, and urban centers. And then I just quickly wanted to go through a list of projects that will be constructed in 2025. So these ones have already been planned out, but you will be seeing them actually built this year. There's going to be pedestrian upgrades taking place on 3rd Street, a portion of 3rd Street. The Cranberry Avenue and Island Highway intersection will be seeing some improvements. Hammond Bay Road Area Utilities Project will lead to some improvements in that area. And if you've been downtown lately, you will see that there is a major project happening on Commercial Street that will be continuing through 2025. So with that, we would welcome the committee's input on which of these projects really stands out to you as having accessibility and inclusion potential. Any questions that you have, Jamie is here. I also have Barbara and Bill from our department as well, who can help with if you have any questions. But yeah, we'd really just like to get kind of preliminary input from you at this time. Thank you.
Thank you. So I'll take a list of people who would like to ask questions, but really what we're looking for here is which items are of greatest interest, and then we'll bring those items back to the committee and we'll have a chance to discuss them more in depth. So we're going to try not to get into like the nitty-gritty of the actual project today, but more identify which ones are priorities for the committee. So first up, I'll go to Sean and then Jocelyn. And Nicole, I'll just ask you to mute your feed, please.
Thank you. So the ones of particular interest, I think within my community, the disability community, the Vision Zero strategy sounds interesting. There's probably some crossover with this one. I think something that emerges is just crossing points on major roads that for people with mobility challenges or people experience disability, walking from one crosswalk to another is often a barrier, and so they jaywalk and then they get hit by a car. Obviously, nobody wants that, but having more crossing points is interesting. And the other one, I suppose, communication with the community, I think is interesting. Certainly when you say the word transportation, particularly in the disability community, everybody thinks two things. None of them are the things that you're talking about. So everybody thinks about buses and handy dart, and none of those are things within the city. You can make recommendations, but really when you're talking about transportation, you're talking about the infrastructure that supports those things largely. It supports moving from those things and off them. So I'm interested in that as a focus because I think people often get stuck in what the city can do and what the city can't do. If people hear transportation and then it's those key things, which are arguably the most problematic things in our transportation system in Nanaimo, aren't spoken to, then I think sometimes people see that as a failure of the city. So, calling it something, I don't know, the communications plan, I would hope would reflect that. But yes, the Vision Zero is definitely the most interesting to me, and the communications. Thanks.
Thank you.
I'll go to Jocelyn and then Richard and Linda. I can't tell if your hand is a holdover or not. Okay, that's a no. Jocelyn.
Hi everyone, Happy New Year. I'm always one of my sort of main issues is always the availability of accessible parking and the enforcement of the availability of accessible parking. We have a lot of buildings with not really any accessible parking. So that's always going to be my number one, because a lot of the folks that my organization serves, if they're lucky enough to have an accessible vehicle, they're stuck. They still can't go anywhere because there's nowhere for them to get out of their vehicles. So it's a real barrier, especially for folks who, with families or family members that, they if they don't have help to get around, the lack of parking is a real issue. Accessible vehicles are getting bigger and accommodate more types of mobility devices, and they need bigger spaces. And most of the ones in my experience that we have are the old ones. And there's lots of standards available in Canada to go with, and there's work Spark did, and lots of ways to follow that. So that would be my first priority, but I would echo street safety and the Vision Zero one, because I still see folks in scooters and wheelchairs wheeling on the street, and we are not very visible. It's just not very safe, and that's a real concern. And one of the 4 projects mentioned about construction, Cranberry Ave Island Highway has removed an exit from the street. It's probably just for construction, I'm not sure, but there wasn't a ramp to get off the street anyway, so people could find themselves crossing that very busy road and not being able to get back up off the road if they use a wheelchair. So it's just things like that where I think infrastructure layers upon each other, and the age is pretty old, and it's like additional barriers for people with mobility devices getting to a safe place.
Thank you. Richard.
I think that first of all, the Vision Zero thing makes me just think blindness, not so much public transportation. So maybe renaming might be a good idea. But I think the improvements to public transit actually answer the issues of accessible public parking in private areas, and it also answers the issues of safety around the city when it comes to like navigating the streets and safety on the streets and such. So if we improve the public transit issues or fix those, then that kind of answers multiple things that are of issue throughout the city. Also, improving the public transit will also remove barriers of isolation, which is consistently something that affects blind people, especially, and other groups that do rely on public transportation, since not everyone has access to a vehicle or an accessible vehicle. So having that accessible public transportation removes the barriers of getting around in the city, and it can help with finding more employment. It can help with answering a lot of those things related to services and that people rely on. So I think that would be the biggest thing, hands down, that the city can focus on to try and improve transportation. And like our city has been in national news in the last year multiple times around our public transportation being not adequate, or issues where vulnerable populations have been affected by it. So I think that would be a great facelift, so to speak, and answering the issues that have been plaguing the city for the longest time.
Thank you, Richard. Appreciate your feedback. And I think your point about the name Vision Zero is well taken. And that's not a name that we generated. It's part of a program. And maybe Madeline, if you could just briefly speak to that.
Sure. Yeah, that's right. I hadn't thought of it that way. So thank you for pointing that out. That is, yeah, a good point. But yeah, Vision Zero is kind of a global initiative. It's a term that's used in a lot of different cities. It's kind of a policy that goes by that name in many different areas. So, I mean, I guess we would have the choice to kind of try to rebrand it for Nanaimo specifically, but I think our hope is that we're kind of jumping on to more of like an international initiative with that one.
Gotcha.
It's more about like the vision of zero pedestrian deaths is
Yes,
sort of my
thank you.
understanding.
Yes, the vision is zero deaths or serious injuries as a result of traffic.
Thank you. Okay, I'm going to go to Bay and then Linda.
Hi, this is also about the Vision Zero. I think it's of high importance, just given the interactions that myself, my family, and just in general I've witnessed between vehicles and pedestrians within the community. I think that in looking at that, raised crosswalks might be a very important tool because they actually make people slow down. And they slow down where pedestrians cross. I've seen in Lanceville how effective that is. Yeah.
Thank you. Linda.
I guess my hand won't go down. I think if you're asking for priorities, parking with curb cuts, it's one thing to provide a parking spot for an accessible vehicle, but unless you have curb cuts, people end up in the street, like Madeline or Jocelyn said. So that's a high priority. And curb cuts lift everybody up. They lift baby strollers, anybody pushing a cart, anything that rolls benefits from a curb cut. The pedestrian unallocated, again, curb cuts, the ones at Front Street and the Old Island Highway, they tip chairs over. So there's only a couple that you can use without being in real danger. And the city has started putting up some of the crosswalk buttons that you just have to wave at, and they speak quite loudly, so that will help people without vision. It helps people who don't have a lot of mobility in their hands that can't actually press a button. And the Vision Zero, as I agree, it's very strangely named. but it sounds like it would help everybody. You know, it's an initiative that will make everyone safer. That's it.
Excellent. Well, thank you everyone for the feedback. And I guess I personally would like to add that the downtown transit hub, I would like that to come back to the committee for feedback, just because of the centralness of that project. And I would assume that one would come back to the committee anyway, but thank you everyone for your input. So we're going to go back to presentations now. We do have Dr. Adam Hoverman in the room with us, and he's going to share a presentation with us about social prescribing. First, an introduction by Darcy Olson.
Osborne.
I'm sorry, Darcy Osborne.
No problem. Good afternoon and Happy New Year to everyone. Today we have the opportunity to learn all about the worldwide movement called social prescribing. Dr. Adam Hoverman is here today to introduce to us all the pilot project that is happening here in Nanaimo. Involved with the project is our Recreation Services Department, and we're very proud of this initiative as it's very much an upstream solution for the social detriments of health and social isolations for lonely seniors in our community. Dr. Hoverman is going to help us understand why the shift in patient care is going from asking the question, what is the matter with you, towards the question of what matters to you. And this is also very important. Social prescribing ties into the city plan and council's strategic priorities as identified in the integrated action plan. It is in our health and wellness services section for the plan, and it speaks to and directs staff to continue to help develop health programs relating to social, recreation, and nutrition in partnership with Island Health and other organizations that provide these services in recreation facilities. This is one example. The Nanaimo Youth Health Hub at the Aquatic Center is another good example. Dr. Hoverman is here today to share with us all about the social prescribing from an overarching umbrella, as well as some medical research behind the approach that is so meaningful. There will be a lot of information shared this afternoon in the presentation, and the goal is really simply to bring awareness about this major health movement to this committee, and to share with you what the city is doing along with the health partners in the social prescribing initiative. We are helping pave the path, and Nanaimo is a leader for social prescribing on a national level, and we're very proud to be part of that. Dr. Adam Hoverman is a family medical physician with the Wellington Medical Clinic and co-lead for the social prescribing in the Nanaimo Division of Family Practice. He completed family medicine residency at the University of Minnesota and preventative medicine residency with a master's in public health in the health management and policy. Adam's present academic post includes clinical instructor roles with the University of British Columbia Faculty of Medicine and the Department of Health Systems and Population Health at the University of Washington School of Public Health. He is previous director of the Office of Global Health and Department of Family Medicine at the Pacific Northwest University Health Sciences. We are very fortunate that Dr. Hoverman currently has a medical practice in Nanaimo and is residing in our community. We have, when we first met Adam a little over a year ago, we knew right away that we had a real direct connection with the medical and health industry in our community, and are very, very pleased to be working with him in our Recreation Services Department. So with that, I would like to introduce Dr. Adam Hoverman.
And Dr. Hoverman is going to share a 15-minute presentation with us. I'm going to give you a 3-minute warning close to the end, just so that we make sure we have time for questions from the committee. Thank you.
Great. Thank you, Darcy. Thank you, Chair. It's a joy to be with you all. Is there a way to advance the slides from here? Terrific. Okay, so I'm Adam Hoverman, as you've heard, and here to share with you a bit of my journey to social prescribing and to make a case of why it's relevant to your journey going forward, particularly to ask the question of how do we manifest social care in the midst of so much healthcare happening. Let's proceed to the next slide. So it's a real honor and a privilege, and I would like to thank the caregivers and the stewards of those who have looked after these lands and waters, the Snemu, Snaneos, Quatsin, Tlaman peoples, and who have caretaken these waters and looked after them since time immemorial. And it's a real privilege to live, work, think, and dialogue on improving health and social care here with you all. Next slide. So in brief, for the short time here with you today, I'd like to share a definition of health, how the social determinants of health folds into that definition in the present improvement arc, how social in particular means society and the context for that happening and the social factors, so support and cohesion there, how loneliness and isolation are now at epidemic proportions, and we have a Surgeon General's report from 2023 to identify that, how context is vital for social prescribing to manifest and be implemented and thrive, and what can we all do about it. Next slide. So, for those who might not have heard of osteopathic medicine and how it evolved in the mid-19th century, Andrew Taylor Still, MD, using the best tools of the time, pre-germ theory, said that the object of the physician should be to find health. Anyone can find disease. And that's what drew me into the study of osteopathic medicine as a DO, and how that really begged the question of what do we mean by health as distinct from health care. Next slide. The WHO, more recently, in 1948, at its formation, gave a definition of health that is to complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Next slide. And I'd ask for us all to think today, if we have great progress being made towards physical and mental well-being, where has social well-being gone in the thick of the crisis of healthcare in the 21st century? Next slide. So, around about 2008, the World Health Organization brought together the nearly half century of research demonstrating the need for identifying the social determinants of health, honestly, the many determinants of health, the non-medical determinants of health, for being a vital way for strengthening health systems. The Department of Health in Hawaii took this call and in their chronic disease management control branch in 2011 formed this report that identified that place is a vital component to addressing the non-medical determinants of health, and used a local landscape and local terms, the Makai downstream, Maoka upstream, to identify a simple or a recognizable graphic that could be used for how we might quite literally head upstream to where those non-medical determinants can best be addressed. Next slide. So in our day-to-day, in the healthcare context, most often in primary care settings, these downstream effects are frequently much the matter of our daily attention, and in part why I was slightly behind for this committee meeting. My apologies. Nonetheless, we see on the shore are those risk factors for these conditions, one that also get a great amount of attention, and directly across the river, access to healthcare. That widely varies based on setting, national settings in particular, for those access points. Next slide. Further up the waterfall, we see the social determinants of health. Income, discrimination, education, geography, place, many such factors that get a great deal of focus in the wider community, such as the setting we're in today, recognizing that these many non-medical determinants of health have their direct impact on bodies, persons, and populations. Next slide. But if we go even further to the top of the waterfall, we see that social and economic conditions and political context and governance are how the Chronic Disease Management and Control Branch from the Department of Health in Hawaii in 2011 made clear where we could go most upstream to have the greatest impact. And this is where social prescribing and the social prescribing movement, as it began coalescing in the National Health Service in the UK and many other national settings globally, have started to begin the work of addressing improving social well-being in primary care and healthcare contexts worldwide. Next slide. The research aligned with all of this makes clear that we have the lion's share of the evidence to demonstrate the impact and the benefit of social relationships on improving health and well-being and longevity at that. And this is from the PLOS Medicine, which is a widely available free access journal, open access journal online called PLOS Medicine. And this is a report, if you go to the next slide, that looked at 125 studies, about 300,000 participants, and showed that cumulatively, social factors, when looked at the odds ratios for decreasing mortality, outpaced the traditional factors of cardiovascular-related mortality: smoking, alcohol, exercise, and exposure to air pollution. So this was over 10 years ago. This report was out there making the evidence clear that we could go the greater mile to improve and decrease mortality or early mortality, or vice versa, to improve longevity by manifesting improved social relationships and opportunities for that in the social and physical built environment. Next slide. Around about that time, I was in London at the doing a diploma in tropical medicine and hygiene at the London School of Hygiene and Tropical Medicine, when this report came out from the British Medical Association, setting a call to action to doctors to say that predominantly non-medical action is required to make an impact on improving the health and life expectancy of individuals and communities. It's one that was greatly compelling for me and altered the course of the trajectory of the last decade plus of my career. Next slide. In that diploma course, however, was the introduction to the work of Audrey Proust and others, who from the Millennium Development Goals were looking at how to reduce maternal and infant mortality. And in this study that was shared with us during a public health lecture series in that program, demonstrated that participatory women's groups improved and decreased maternal and infant mortality simply by doing the things that we know how to do as a species. By gathering, sharing, and caring for each other, to discuss danger signs, raise community-wide support, organize transportation, and contribute to emergency funds for transportation and healthcare costs. And that in itself decreased infant and maternal mortality to a significant degree. Again, that motivated me to think differently about addressing the work of primary care and family medicine. Next slide. So upon returning to the Pacific Northwest, soon after that certificate program, there was an opportunity to meet a mentor, Byron Haney, who is a family physician in Ellensburg, Washington, not far from where I was teaching osteopathic medical students in Yakima. And Byron, for about a decade prior, had been found to have a large number of patients reversing their diabetes through these shared medical appointments, such that Group Health, a large Seattle healthcare insurer at the time, identified that something identified Dr. Haney as an outlier and got curious about what was happening. It was just simply this: medical appointments with 8 to 12 others in an interprofessional fashion, usually with a nurse, sometimes with a nutritionist and others from the clinic, who would lead conversations about how they were engaging over 90 minutes the challenges of living day to day with diabetes. And as their patients with diabetes were improving drastically, it drew our interest as well. Next slide. And so I collaborated and began as an instructor, family medicine instructor, began bringing junior medical students there and learned a great deal about how this was a vital component for strengthening primary care, such that we got funding from a Gold Humanism Foundation and interest from the New York Times that did this article in 2016. And now is that article that we published out of this work is now the basis, or at least included in, Nova Scotia Health Authority's promotion of group medical visits. And we've been doing these locally, thanks to the partnership with Parks, Recreation, and Culture here at the City of Nanaimo, to focus on hypertension, diabetes, cholesterol, and the What Matters to Me workbook that I'm happy to talk with you all about further later sessions. Next slide. Which is to say, how do we address social well-being when we know we have an epidemic of loneliness and isolation in this community and globally, precipitated in large part by the ripple effects of the lockdown from the pandemic, but also by the techno-scientific age that's leading us to greater and greater separation in our daily lives, simply by the proliferation of the screens, such that the Surgeon General in summer of 2023 made clear it's equivalent to the smoking of 15 cigarettes a day on cardiovascular-related mortality. So I pose for you all, when we see those red circles with the hash lines through them around loneliness and isolation, such as we've become accustomed to and why no one is smoking cigarettes in this building here today, maybe we might think about that in the next 50 years for addressing this epidemic. Next slide. So upon arrival in summer of 2022 here to Nanaimo, began collaborating with colleagues at the Canadian Alliance for Social Connection and Health, such that we now have a set of guidelines for social connectedness that were recently presented at the Human Connection Conference at Simon Fraser University this autumn, where Bonnie Henry was in attendance and quite gleefully said she would champion them at the Public Health Agency of Canada in Ottawa later this year. So we could say that this is now taking shape on a national scale here in Canada to a vigorous degree, so now how do we bring it more locally? Next slide. The way to bring much of what's been learned from the National Health Service on social prescribing, where they have established a Ministry of Loneliness and implemented something to the tune of 3,000 link workers across the National Health Service in the UK over the last several years, has been condensed to the Canadian Institute of Social Prescribing at the University of Toronto, which provided the backbone support for the Nanaimo Social Prescribing Project that's received 2 years of shared care funding for implementing here in Nanaimo a very unique intersectoral partnership, bringing these objectives to mind by the collaboration with the City, Parks, Recreation and Culture, Vancouver Island University, Recreation and Tourism Department, Vancouver Island Health Authority, and the Division of Family Practice. Next slide. I would have to say that the unique predisposing factors are thanks to the City Council, Mayor and Council's adoption of Kate Raworth's donut economics model for the 2023-26 strategic plan, which has a component of Healthy Nanaimo, which made the earliest conversations with Darcy, Laura, and others so tremendously streamlined to help this conversation happen, not only to pilot group medical visits at Bowen Community Center, but also the wider social prescribing project across the city, which is now happening. Next slide. And happening thanks to the WHO's implementation guide on social prescribing, which provides an idealized link worker model that you see here. That you see at the center of the graph, a link worker who is closely aligned with the primary care setting, the primary health care setting, where when loneliness is identified through a great many measures and means, can then go with the link worker to the community setting, to the activity that specifically responds to the question, what matters to you? Make those warm handoffs and introductions. Ideally, if they love ukulele playing, but they haven't been recently, get them a ukulele, get them connected to the ukulele classes, and then loop back in a model, using the model of improvement back to the primary care setting. Say, how did it go? How could it go better next time? How can we widen the access to these services? And this is the implementation guide that's been the backbone for our Nanaimo social prescribing project with the shared care pilot funding at present. Next slide. So coming up on mid-March of this year, I'll have to double check the date, I think it's March 19th, we will be looking at an array of activities around the International Social Prescribing Day, inviting Julia Holtz, who is a healthcare journalist that has published a recent book that I highly recommend to you all. I brought a copy here today to share, called The Connection Cure, The Prescriptive Power of Movement, Nature, Art, Service, and Belonging. And Julie has responded to an invitation to come and speak here in Nanaimo on this book on March 2nd, which we're looking at hosting and quite excited about that opportunity for the further dialogue, and how the social prescribing movement aligns with the What Matters to You movement, so that this is an always question in all healthcare settings, asking and meaningfully responding to the question, what matters to you? Next slide. But as a point of clarification, Julia has recently read an opinion article for the Wall Street Journal to say that social prescribing in and of itself is no panacea, but simply helps to serve to reconnect us to each other in this time of great disconnection. And maybe from that, we might learn how to improve the wider systems of health and healthcare going forward. Next slide. So with that, I would just reiterate that context matters immensely. Places where this really begins from, and honoring both the wisdom and the skill sets and the experiences inherent in place are vital for social prescribing to take place. That loneliness and social isolation are now epidemic. We have reason to respond. And that by social, when we speak of the social and the many non-medical determinants of health, we're talking about those factors, those social factors that help improve cohesion. That social prescribing can be learned, implemented, and improved, and most of all, may we practice every day asking the question and meaningfully responding to what matters to you. With that, over to the chair for questions, and thank you for your attention.
Thank you so much for your presentation. So I know that social prescribing is still sort of just getting off the ground in Nanaimo, but I'd just like to start off by asking, how many people have we been able to impact so far through the program, and what are your goals for the next year as far as reach?
It's a great question. So I'd like to preface by saying this was meant to be an early introduction to the meaningfulness of social prescribing in the project that's taking shape. The evaluation, including the numbers of those served, both through the Health Authority Link Worker and Nanaimo Family Life Community Connectors, still pending getting those numbers to share with you, and I look forward to doing so at future presentations with other colleagues. And the reach beyond is to expand numbers of link workers and community connectors and other models, pathways, where social prescribing can be manifest as bridges to primary care environments across the community. So my apologies for not having specific numbers for you today. We will shortly, though, as the evaluation progresses out of this current initial project.
Thank you.
I see hands elsewhere.
Sean?
Hi, thank you for that. So I work with Nanaimo Association for Community Living. We support adults with intellectual and developmental disabilities. Our model is similar to this. So it's all based on person-centered planning, which is what matters to people. We help people connect with things that are important to them. Many of the, so one of the challenges that we have, and I'm interested in knowing what opportunities would exist to connect people with this today. So we know this is happening. We know that when we connect people to activities, when we help people make social connections, that they have improved quality of life outcomes kind of across the board, whether it's employment or housing or anything, that improves everything. But we don't know where the opportunities are because it's not apparent how we connect people with those opportunities to be able to do those things. So does social prescribing, does this model help alleviate that through the people that make the prescription? So I assume it's a doctor or someone that's making that prescription. So logistically, like, how does it actually work? If we have 200 people in service that would probably all benefit from this in some way, what then do we do with it?
So here we are at this very nascent moment, less than a year into having a formal social prescribing link worker referral that can be made through the geriatric subspecialty services. That primarily at this point, and thanks to the invitation to speak to the committee today, is to raise awareness that that referral pathway exists in order to make sure that individuals and community members, their families, are aware that their GP can simply write social prescribing link worker on a geriatric subspecialty services referral form for Island Health to get connected to the link worker referral program, which would then determine the pathway further for connecting with the link worker, the Health Authority link worker, or Nanaimo Family Life community connectors and their further programs. We're at such a stage where the evaluation is needed, and in order to expand the reach to the even 200 you're describing.
So you said geriatric, so is this focused on seniors?
At present, yes.
Okay.
At present. And there's an equivalent program that I presume you've heard before by Dr. Potterico and Joanne Schroeder regarding the recreation prescriptions for youth. We are looking at a life course reach for this on the horizon line.
I'm going
That's
to go
grade 5, yeah, just to clear.
to Jocelyn next.
Hi there. I work with Spinal Cord Injury BC, and we are a peer support organization largely, and also have an info line. And we work with people who are living with spinal cord injury and similar physical disabilities largely. And there's certainly a lot of our approach, our model is very similar in the way that we believe that people with shared life experiences can often help each other be healthy, active, and connected. And I see a lot of sort of opportunity here down the road for folks with some of the very same struggles who are not seniors yet or who are also younger. Because once you've had a life-altering physical disability, isolation, depression, anxiety, and loneliness are very common, and it's hard to re-enter your life after an injury like that, and your community. So the thing I just wanted to say was that in thinking about how we can do this for people with disabilities as well down the road, I'm just curious how it's working for your current participants who don't have family doctors, because we find for our population that is one of the absolute biggest barriers to getting appropriate help and support and care at all, regardless of what kind. And not to like pull down your like awesome presentation. It's just like this issue of family doctor availability seems to be like the crux of so many issues.
Thank you for that excellent question. Can you remind me your name again? I don't see it on the screen. Oh, there it is, Jocelyn. There. I was told not to look back on the screen. Okay. Thank you, Jocelyn. Really appreciate all that you do and the magnificent work with Spinal Cord BC. I actually am recently acquainted with the adaptive cycling program and quite keen to stay in contact with you going forward and others at Spinal Cord BC for its relevance, its tremendous relevance to what we're talking about. So please do critique this, right? I think the only way this further improves if we do iterative cycles of improvement and do that reflective learning for how it can, take the feedback, especially around the concern of is a attached relationship with a GP the primary portal or entryway. And so from early on, we've been talking about the over-the-counter component of this too, which led to the collaborations with Nanaimo Family Life that essentially equivalent to what was discussed before. No door is the wrong door, and anyone can self-refer into Nanaimo Family Life in that way. At the same time, it's clear that there's a need for the use of the spaces that are already available. And I think I wanted to elevate how the community centers, the libraries, groups like Harbor City Seniors are so vital for this because they are in the outer orbit of this, where much of, as Darcy and Laura said early on, get them in the door and we'll do the rest. So it's to say that, yes, we need the family physicians in the community, those with GPs, to be aware that they can ask for a referral that way. But as we build the bridge, as we strengthen the health system in this way through an approach using the social prescribing implementation toolkit, that it will allow a wider array of entry points beyond just those with GPs, while also working hard on addressing that the GP crisis in the province for certain.
Okay, thank you.
Through, I should add, team-based care, right? And for anyone who hasn't heard of the primary care network, this is to say that is in the trajectory of helping improve attachment to existing panels for physicians in the community. So along with the recruitment, along with increasing the training opportunities through the start of the Simon Fraser Medical School this coming in 2026, as I gather, but the need for improved team-based care is how that accessibility can improve. And presently through the primary care network, we have physician, pharmacist, nurse, counselor, and social worker. And in my heart of hearts, hopefully soon to have link workers in that primary care network to be able to expand and extend existing panels for improved access in that regard too. So thinking how the primary care network plays a vital role in helping improve access that way, as well as our community centers and the terrific services already available across the city.
Well, thank you very much for the presentation. Thank you to the committee for all of your questions, and Dr. Hoverman for your dedication to social prescribing, and to Darcy Osborne for helping the city support this path. It's really important. So really appreciate all your work on this and look forward to future updates with excellent numbers about how many people we're helping.
As well. Thank you, Chair.
Awesome.
Thanks you all.
Thank you. So we're moving back into reports now, and we have a verbal update on the internal style guide for internal and external communications. And we have our manager of corporate communications, Dale Burgos, with us today to share this. Also our manager of community relations.
Thank you, Chair. Good evening, everyone. Maybe if I can ask for the internal style guide to be put on the screen. Perfect. And maybe just a couple pages in we'll start on the table of contents. And good evening, everyone. Yes, thank you for having me and giving me the opportunity to share an update in the internal style guide. Now, the style guide itself, I should point out, is something that we've had in the city for quite some time now. I think about 10 years for the first iteration of this document. And also within this document includes some information on, and I'd like to just point this out, so tone and voice, and that's what I'm going to be focusing on for the first part. Tone and voice, and then we've also had some pieces in there that would That would be everything from grammatical to just instructions on how someone here in the city would use this document in terms of just writing or using it in documentation. Now, now this one here, this is our brand guidelines. I'm wondering, do you also have the writer's style guide as well, Jess? If not, that's okay, because it's all verbal. I can just talk about it, so that's not a big deal. I'll give you a second to do that as well. And so maybe what I'll do is we took some time last year, I can't believe it's 2025 already, but in October of 2024, took some time to go through the document and figure out just exactly where it needed to be updated. And in terms of just where we had to update was more on just the tone and voice. Tone and voice was very important, something that we address, and I'm glad that the Akai group here had asked that we do an update on that. It was needed, and of course that was also noted in the integrated action plan as well, that we needed to have that updated. Now, and that's okay, Jess. I can just talk on it if you'd like. If you don't have it. So some of the big pieces in there, bias-free writing is where we really wanted to focus on, and for that first portion that I mentioned, tone and voice was really important for us to discuss. Maybe I'll just go through just memory here exactly. So for example, we wanted to avoid, make it clear that we should avoid gender-specific pronouns. We don't say he, she, especially because we can't just assume pronouns, and the ones that we're using may not be correct. So in terms of when we're talking about gender-inclusive pronouns, using they as a singular is an example. Referring to people as they. And oftentimes people go, well, I can't wrap my head around that. How do I do that? Well, we often do that without really realizing that when we talk about a person or a group, we use the words they instead. And another piece too, I notice a lot of people, when they're addressing groups, they say, hey guys, how's it going? And people do that all the time. I'm bad for it sometimes. This is not in the style guide. However, I try and use that daily, just saying, instead of saying hi guys, saying hi everyone or hi team. We've taken some training here in the city, and we've had someone come in and provide that inclusive training, and it's a really good tool for everyone to start using. So again, wrapping people's heads around that idea is just an example. Furthermore, we like to use gender-neutral terms such as firefighter or chairperson instead of fireman or chairman, right? So those are another example. So those pieces were taken out or referenced specifically in the internal style guide. Continuing on, avoiding language that suggests persons with disabilities are separate from the community. That, again, goes against everything, of course, in terms of inclusion. So, as an example, don't use the following: disabled, special, handicap, or special needs. That's not suggested terminology, but do use persons with disabilities as an example. Again, that's all in the document. So persons with disabilities or people with disabilities. Some terms that we shouldn't use again, and again, this is in the style guide, don't use the term able-bodied when you're referring or describing a person without disabilities. Again, that's, I'll say, oh, there you go. Yeah, perfect. Thank you. And so that, if you go in a couple pages in, Jess, I think it's page 1 or 2, past the table of contents, and I'll give you a second to do that, no problem. I am talking a little fast, so again, please tell me to slow down. Perfect, and there you go. And somewhat ironic, I've used the color blue over top of text, which is not very accessible, which I'll be getting into in my next topic. But for those of you at home, I'm sure you can see this quite clearly. For those of you around the room or in the back, all those points that I had just mentioned, the do's and don'ts, some of the changes, those are all highlighted in the light blue that you see on the screen here. Okay.
Excuse me, not everyone at home can see.
Oh, you can't see.
On the
Okay.
screen clearly because of vision.
Thank you very much. See, there you go. And that's why we're having the conversation here. And that is why I wanted to make sure that I also gave a verbal report for this as well. So all those points that are highlighted on the screen, for those that may not see it, I did reference every single one of those points that are highlighted on the screen right now. Okay. That essentially are all the changes that took place or that are changed in the internal style guide. Just wondering if anyone had any questions or maybe any suggestions.
Not seeing any hands at the moment from the committee.
Okay, thank you, Chair. If not, then shall I move on to the next one?
Yes, let's continue to the next verbal update on the city statement on accessibility, equity, and inclusion.
Perfect. Okay, I've received some feedback, thank you, Chair. I've received some feedback on where the initial request came from, and Ms. Osborne had shared that with a group of us. If I may, before I get into the statement itself, if I may just maybe pose it to the Chair, who may then pose it to the committee or those visiting. Where did this request come from? What was the intent? Where would it be used? So on and so forth, if I may.
I do not have an answer for that. General interest, I think, and expertise among folks on the committee who may be able to offer special insight. Sean?
I think part of it was that there wasn't a clear definition of what was meant by accessibility or inclusion. I think we talk about those terms a lot, and certainly in different circles, they have different meanings to different people. But there's been many cases, just throughout interacting. NIMO, accessibility means different things. So we need to have a clear definition of what accessibility means in the context of the city, what inclusion means in the context of the work that we in the city are doing.
Okay.
So that was sort of the impetus, is like, as we are the accessibility committee, let's talk actually about what that means. As we are the inclusion committee, let's actually talk about what we mean by that. And so that helps frame future conversations.
Okay.
Thank you.
Through the chair. Thank you, Sean. I appreciate that context. Before I moved on to the actual presentation or to my verbal update, I wanted to make sure that I am hitting all the points that was requested of this group. And so with that, we do have a statement which I believe may be put on the screen, but I can also, of course, give it verbally as well. And we also have a link to a page on our website, which is about accessibility and inclusion, I believe it is. So that will also be put on the screen. If I may just take a few minutes, though, I would like to just share and read out the proposed statement I brought the wrong glasses here. Okay, this is the proposed statement for this meeting. And it was an updated version of what was shared by Ms. Osborne's team, which was used in Grant, I believe it was. And we took it to a different step and a little bit more and clarified a little bit more in terms of inclusion. And so if I may just read that out now for just a few seconds here. It's just one short paragraph. The City of Nanaimo is committed to fostering an environment where accessibility, equity, and inclusion are at the core of every decision. We recognize that true equity means creating opportunities tailored to the diverse needs of our community, ensuring that everyone, regardless of ability, age, gender identity, race, religion, or background, has the support they need to thrive. Through proactive policies and inclusive practices, we seek to remove barriers and create a city where everyone feels valued, respected, and empowered to participate fully. Okay, we could share this with the group afterwards through email or however way you'd like to do that. This statement is essentially, I believe, my feeling is it's all encompassing. It provides, I'm hoping, the direction that the committee was looking for. And again, if you'd like, I can read it out again, but this was just one of those examples of what we can use. Now, in terms of where we can use it, we can use it in multiple different places. We can, of course, so for example, here's the page right here on accessibility and inclusion. We could share that statement on this page. We can use it in our key messages that we use as a city. So anytime that we have any questions from the community or from the media in terms of accessibility or inclusion, that statement can also be made. It could be used in further future grants, for example. Many different options. And on this page here, if you haven't seen it before, and I will maybe quickly just talk through it right now. The page is accessibility and inclusion. This is on the City of Nanaimo webpage. On the very top is essentially some information that we have on the city in terms of accessibility and inclusion. We have some bullet points on there as well. I won't read through all of them just for the sake of time. Some of the highlights or some of the headings in here, for example, Advisory Committee on Accessibility and Inclusiveness. So that is, of course, this group here. It provides some background information on this group. And maybe, Jess, if I can ask if I can scroll down, or if you can scroll down or up, whichever way that makes sense. There's also more information on collecting feedback on accessibility and inclusion, and there's a feedback form. Not sure how this form has been used in the past, but I did click on it, made sure that, of course, that it is accessible. And I see nodding heads here, so it has been used before. And then further down on the page is just more information on accessibility and inclusion here in the city, providing some documentation. I believe there's a bylaw in place there, or section C, sorry, equity and inclusivity, section C 4.2 of the city plan is also mentioned in there as well. Again, there's a lot of information on this page. I won't go through all of it right now, but I thought I'd maybe just stop there.
Yeah, I appreciate you sharing that with us, and I do think it would make sense to have the statement at the top of that page. I did notice in the first paragraph of even what exists there, there's a couple accidental double spaces between words that needs a
How old is that?
minor editing, but that's a classic, real non-issue. But I see now we've put the statement that you read out up on the screen.
Oh, there.
We can potentially wordsmith that today if there's feedback from the committee. I do see Sean.
So, yeah, I think the spirit of it is good. I think one thing that often comes up in conversations around inclusive language, certainly with many of the people that I support at work, is whether it's functionally readable. So whether it's in either plain language or better. And so one of the things about this, while I think this is good, I think, for instance, a sentence like, through proactive policies and inclusive practices, we seek to remove barriers and create a city where everyone feels valued, respected, and empowered to participate fully, is not an intrinsically readable sentence. So I think I'm always interested, and generally in this sort of stuff, you often have to trade specificity for accessibility. So there is a trade-off. The more specific you are, the less readable a thing is, generally. It would be great if, particularly in our conversations and, outward-facing content around accessibility, that those things followed plain language doctrines. So is that something that you are doing? Like, are you applying the plain language standards to the things that are being written about accessibility?
I'll be honest, not all the time.
Okay.
Right. So,
Can you do it all the
but we
time?
are going to be working towards that. Yes. Thank you, Sean.
And just to follow up on that, could you have an opening statement that is in very plain language and then one that is a bit more detailed potentially? Is that ever appropriate to have an opening sentence that says everyone belongs, we're working on creating a city where everyone belongs, and then have a more elaborate description to cover all of the bases that we wish?
So to that end, most governments, including government of BC and the feds, are adopting universal plain language. So plain language doesn't mean inherently, you can generally accomplish all the things that you're talking about through plain language. Easy read, generally not. So what most organizations are doing, and we're not seeing it so much in Canada, but we are seeing it a lot more in the UK, so they're adopting easy read more broadly. And what you see is they do provide most stuff in plain language, and then they'll provide a supplemental easy read version to go with it. Like, everybody deserves to have the same rights. Everybody deserves to have a place to live. Everybody deserves to participate in our community or be a part of the community. So yes, having both, but plain language, generally you can achieve most of this so it wouldn't be a significant edit, but it would just be a couple of tweaks to ensure that it was readable to most people.
Okay,
And
appreciate
then
that.
easy read version to go with it.
I'm going to go back to Mr. Burgos, and then I see hands from Councillor Armstrong and Bay, and then Alexandria.
Okay. Thank you, Chair. And through the Chair, I just wanted to ask Sean a question, maybe for some clarification about plain language. We also, we address anything that we write in terms of reading level as well. Is that something that's tied into, and I'm just curious as to where you're at, is that related to plain language in terms of reading level? So we try and write to grade 5. That's always been the plan. It used to be grade 8, grade 5, with the use of more screens now, and going to our previous presenter, there's some suggestions that we are even now writing at grade 4 level, right? I'm just curious though.
Readability, which is what you're talking about, is one indicator of plain language, but it's not the only one. So when you're doing plain language, one of the things you can look at are whichever one you're using. I don't know if you're using Gunning Fog or Flesh Kincaid, but whichever one you're using to sort of measure your readability, that is one way you can do it, but that has gaps in it. So even when you're writing to those, you can miss out on some of the plain language tenets. So plain language takes it further and includes, for instance, active voice versus passive voice. So other things, and there are standards for that. There are some simple things you can do in that, but yeah. So readability is one component of plain language, and then there's other things included in that as well. Does that answer your question?
Yes, thank you.
Thanks.
Okay, Councillor Armstrong, and then Bay, and then Alexandria.
Thank you. Yeah, I've been following a lot of what's happening, like, in the States where they're getting rid of all of these policies, et cetera, et cetera. And one of the reasons is because of when we use terms like proactive policies and inclusive practices. And they said, you should just go back through your policies and practices, because it's those terms that are turning a lot of people off. So they don't even bother following that stuff. So I don't know if that's something that we're looking at, the research that's coming out of the States as to why the policies are failing. Have we done that?
Oh, okay, sure. Thank you, Councillor Armstrong. Great question. I like to talk, and this is one of those times that I don't really have much to say. So not something that's really been discussed. I'm not sure exactly why that is. And the States is a very different, I'll say, animal than we are in Canada. But definitely something that I'm going to make note of here, and maybe it's something that we can start addressing in the future.
Yeah, and just follow up on that. There's many universities now in Canada that are doing away with the DEI and all that as well because of all the problems that it's causing. So I think it'd be very interesting to look at how they're changing their statements to be better reflective so that there's more community buy-in, because we need community buy-in. And if we're turning community against it based on some of our statements, I don't see how that's helpful. So just some things for thought. Like, there's a lot of research happening in Canada as well. Thank you.
I think that, I appreciate the point, Councillor Armstrong. It speaks to the fact that we're just incorporating this as a new baseline. So we don't even need to specify that it is inclusive language. It just becomes the norm for us. So it's not like we're doing anything different. And it's the way that, similarly, we don't even really talk about like active transportation anymore. It just is transportation, period. And that is truly the most inclusive thing possible, where you're not saying it's specific to one group. It includes everyone, and it as you said, it makes it easier to buy in for everyone. Bay.
Oh yeah, I kind of changed my mind, but initially I was just going to mention that for plain language, I've seen academic articles where they start with the abstract and there's a plain language summary that just gives you a quick insight to it. But I'm not sure that pointing out something as a plain language summary is necessarily ideal, especially just given what Cheryl was saying.
Thank you. I'm going to go next to Alexandria.
Thank you. Still on the topic of plain language, I wonder, and this is stepping back to the internal style guide, is plain language referred to or set as the bar for writing in the internal style guide?
I'll say this, and the answer is yes. I believe when they went through this before. However, I think there can always be some adjustments and changes. In 2014, when this was first developed, I'm going to say that it probably wasn't, top of mind or first and foremost in here. Going through it sounded as if it needed to be just as plain as possible in terms of when we're using it or when we're using our writing here in the city. But if I may, just take that lens, take that away, and let me look at it again with that concept in mind.
Excellent.
Thanks,
the federal government is in the process of finalizing the communication standard, which does specify plain language at this point, and it's expected that this will trickle down to the provincial level and I think the municipal level
That's
as
right.
well. So, thank you.
Thank you.
Councillor Armstrong, is your hand up a holdover? Okay. So not seeing any further questions or hands from committee members, so thank you. You have something else to add,
Thank you,
I can
Chair.
see.
Please, yes, please, if I could, just, again, thanks, everyone. Great questions and great comments. Not on the agenda here, but I just wanted to quickly point out, I had a great conversation the other day with my team and with IT, and we are looking at addressing accessibility for our website. And I just wanted to let everyone know that here in this room, it's very important to me that we have an accessible website. I'm saying, there's a lot of pieces to it right now. This website has been in existence for a long time. There are a lot of pages that just are not considered accessible. And so we're looking at the WCAG 2.0 guidelines. The province has not instituted that with a deadline yet. I believe Ontario started in 2021. BC has not. However, we'd like to get ahead of that curve. There's been no announcement, but again, I just wanted to make sure that we address that, and I just wanted to share that with this group. So thank you, Chair.
Awesome. Thank you so much for your leadership on that. We really appreciate that. And anything to make the website more accessible, absolutely. We all benefit from that.
Yes.
So next up, we have a verbal update from Darcy Osborne about the Inclusion BC Everyone Belongs Conference.
Hello, we just wanted to draw everyone's attention to the Inclusion BC Everyone Belongs Conference. Find Empowerment Through Connection is British Columbia's biggest learning event for intellectual and developmental disabilities, inclusion, and diversity. This year, celebrating Inclusion BC's 70th anniversary by partnering with Inclusion Canada and Aspire Richmond for the national event. The conference is a fantastic opportunity to connect, share, and get the latest information and resources on inclusion and diversity. Everyone Belongs is open to everyone, including people with intellectual and developmental disabilities, family members, advocates, educators, government representatives, volunteers, disability support workers, and allies for inclusion and diversity. The event is happening June 19th through the 21st in Richmond at the River Rock Casino. We are actually hoping to be able to send one of our staff members so that they can go and listen and learn as much as they can at this conference and be able to come back to this committee and present information that they were able to take away. And we wanted to make sure that the information was passed on to all of you so that you can mark it into your calendars, and if it's something that you feel valuable for you to attend, that you're aware. All right, thank you.
Thank you so much for sharing that. And so next up, we have an item that was a late addition, an update on an upcoming event and the accessibility component connected to Luminous Paths, which is a celebration marking the 150th anniversary of the incorporation of the city of Nanaimo. And this is going to be a month-long event. And Ms. Osborne is going to tell us a little bit more about it. Oh, and pardon me, before I do see, Richard, your hand is up. Oh, and it is down. Oh, okay, sorry, pardon me.
I don't know what's happening, but
Sorry, that was Ledge Services somehow put your hand up, but sorry about that. Okay, so we'll move into...
no, that was me.
Oh, it was.
I wanted to say something from the last presenter, actually. Regarding the accessibility of the website, I have a lot of experience when doing like testing of websites through screen readers and such. I would be happy to help with any sort of like testing and whatnot of screen reader compatibilities with the website.
Really appreciate your offer of that, and I'll be sure to put Mr. Burgos in touch with you so that you can help be a beta tester for us. We really appreciate that. Thank you, Richard. Okay.
All right. I'm here to update everyone on a Luminous Path, Nanaimo's 150 years and beyond. Here, I don't know if everyone can see the poster online, but we will provide some information on where you can get to the poster online. We wanted to invite everyone, for you and your family and friends, to join us as we mark this significant milestone. It's 150 years since the first City Council meeting for the newly incorporated City of Nanaimo was December 24th, was the actual incorporation date. However, the first inaugural council meeting was on January 22nd. So this year, on January 22nd, 2025, from 5 to 9 p.m. at Maffeo Sutton Park, we will gather for the opening of Luminous Paths, Nanaimo's 150 years and beyond. The free month-long Winter Art Festival is a celebration of light, art, land, and community. There are temporary light-based art installations will illuminate and transform the park's public space into something new, an interactive experience that ignites imagination, inspiring hope, and excitement for the future of our community. The Luminous Path opening event will feature performances from local musicians and roving LED entertainers, food trucks, interactive booths and activities, a display of commemorative Nanaimo 150 merchandise, and even an opportunity to tour the HMCS Nanaimo on select dates, of course. Illuminated art installations will be on display in identified public spaces, encouraging visitors to explore the park and the community spaces. Artists featured will include Bailey McRae, David Martinello, Jenny Smith, Mauro Dalla Costa, and Monkey See Interactive. The art installations will remain on display in Maffeo Sutton Park until closing each day and up until February 17th, which is Family Day, from 4 to 8 p.m. at Maffeo Sutton Park. Specifically, though, we wanted to recognize the Advisory Committee on Accessibility and Inclusiveness provided our Culture and Events team with some valuable feedback this past year, which they utilized in the planning process, and the feedback that you provided was kept in mind and incorporated in a number of different ways. So this festival, which is a month-long festival, has parking attendants present at the opening and closing of the events to ensure easy access for accessible parking and the drop-off zones. The art installations will be available throughout the festival. Anyone who does not wish to experience the artwork in a busy festival environment will still have an opportunity to enjoy and engage through the course of the multiple weeks. So we definitely heard the concern about overstimulation, and this is an opportunity to spread out the event throughout a course of a month. Art installations will be spread throughout Maffeo Sutton Park and are adjacent to the pathway system. An interaction online map will include all information, including the art installation's locations and information on the artist and concept behind the project. And there is descriptive audio of art projects that will be available online. So we tried to take away some of the feedback that was provided and implement and incorporate that into this month-long event. However, the other key component to it all is that it is a month-long event, and so if you are able to attend early on and identify anything that would be a barrier to your ability to enjoy the event, please pass on that information to our culture and events team, and we'll work to try to work along throughout the month to ensure that it is a truly inclusive and accessible event. So, thank you.
Thank you very much. Seeing nodding from the committee members, no questions, so thank you for that. And then we have our last late addition for today's agenda, which is a verbal update on the Neck Point parking lot project. Council has decided that this is a priority, that we want to see it paved and unpotholed. Ms. Osborne?
Yeah, so I'm just going to introduce today Pete Entwistle, who's our, did I say that right? Entwistle, our Parks Project Coordinator. Pete delivers many of our capital projects in the Parks portfolio, most recently including the new pickleball courts at Bevan Park and the Marie Davidson BMX track redevelopment. The paving of Net Point parking lot is a project that was recently added to our capital plan for 2025 implementation and supported from council, who noted the popularity of this park and the importance that we improve the accessibility. The parking lot is presently gravel and requires lots of maintenance, and there are only two accessible parking spots present. In 2023, the accessible washroom and Moby mats were added. The washroom is at the rear of the gravel parking lot, and the Moby mat is on the north end of Finn Beach off the parking lot. We are currently in the preliminary design stage and are open for feedback from the committee. So Pete is here today to provide more information on the project and collect some feedback. So, Pete.
Thanks, everyone. Happy to be here. First time speaking into a mic in a while, so bear with me if you at home, if I'm distorting your speakers. So on screen right now is a conceptual design of what we've come up with so far. For those of you who may or may not have been to this park, you head north down Morningside Drive. The parking lot's on your left-hand side. It's kind of a one-way in, one-way out C shape. The new design has a raised crosswalk at the north end just before the entrance as you turn left. We're introducing 32 standard stalls. There's 8 small car stalls, and we have 3 accessible stalls. Now those accessible stalls are in the southwest corner, pretty much where they are now by the new washroom building. If we go to the next slide there. So this picture just shows an aerial view of the park, Neck Point. It shows Hammond Bay Elementary School at the south. It shows where the parking lot is adjacent to Finn Beach. So Finn Beach would be to the east side of the park, with Sunset Beach to the far west of the park. Next slide, please. So this slide represents what the park would actually look like with the new parking lot design overlaid on the aerial view. So I've zoomed in on this again. It's a C-shaped design, one way in, one way out. So as you come down Morningside Drive, on your left-hand side, right before the entrance, you'll have your raised crosswalk. You'll have your standard parking lot stalls, and then your accessibility stalls right in front of the washroom building. So that those accessible stalls, they measure 3.70 meters wide and a length of 5.60 meters. One of the things that I heard earlier, and I want to make sure I have the terminology right, is curb cuts. My first feedback here is this design doesn't really incorporate that because of a rain garden in between those accessible stalls and that washroom building. It's a split rail fence and a garden through there, so that's going to make it a little bit challenging just from how I see this design. That first stall, so let's call that the far west stall, you're looking at a distance of 10 meters to get around the corner to the washroom building. The far south stall, so the third one down from that, to go around the other way, you're looking at about a 30-meter walk. So this is the concept that we've come up with right now. By no means is this a final design, and I'm just looking for your feedback on what's important for park users. Do we have the accessible stalls in the correct spot to utilize the park efficiently? In this picture, you do see the approximate location of that Moby mat. So that's going to be to the east of that crosswalk. And that's about a 63-meter walk from the far northeast corner of the map. So that first yellow stall that you see there in the northeast corner, you'll be walking 63 meters. Where those accessible stalls are right now, that bottom one, you're over at 100 meters to walk to that Moby mat. So I just wanted to give you a bit of perspective of what you're looking at with those accessible stalls. I'll leave that map up and feel free to provide me any feedback, okay?
Thank you. Linda?
It's great to see plans and parking. The Canadian Standards Association has partnered with Accessibility Canada. So if you look at their standards for parking stalls, it's called B651-18, Accessible Design for the Built Environment, and it's available free online. It will tell you how wide they need to be. You need to have an aisle either between each set of 2 stalls so that people can get out of their vans in their wheelchair. And you can't put people into traffic to walk. So when they come out of their vehicle, they need to move forward with a curb cut. And a curb cut is just the lowering of the curb, so it's level with the ground. So if I understood you right, people would be coming out of their cars and then landing in traffic on that C route, and that isn't ideal. It's just dangerous. And I'm noticing that the path, you've put the MobiMat at the absolute furthest distance. Maybe that's because of slope, I don't know. But is that path paved? Because no one that needs a MobiMat is going to be walking there.
Thanks for your feedback on that one. So the MobiMat, two parts to that answer. One, it was off a hard surface trail, so I wouldn't call it a paved trail. It's hard gravel. After walking it today, I did see a few spots where it could use some improvement, but it's also the slope there that's a little bit easier for access with that MobiMat. But the main thing there was because the trailway was already there. But that was my first thought too, is those accessible stalls. That's a long ways to go to get access to the water.
If I can just add, try not to walk things, borrow a wheelchair and wheel them. So the city must have a wheelchair, or you can borrow one from any of the dealers or rent one. But people's attitude changes enormously when they just try even a short distance in a wheelchair. You'll find that cross slope matters, downward and upward slope matters in a way that you can't experience when you're walking. So I've put lots of people at VIU in facilities in wheelchairs, and they're never the same afterwards, even if it's just 15 minutes. So it's just an idea.
No, I appreciate that. Thank you very much.
And just as far as the standards around the parking spaces, it's a challenging design because of how constrained that parking lot is. Can you speak to whether the suggestion around like the drive aisle and putting people into, like, allowing them to exit their vehicle in a space that wouldn't be exiting right into where the cars would be driving, like, can that be possible in that space? I know we've got the section of trees in the middle there that we're building around. We obviously seems to be a desire to protect those.
Yeah, so that was my first kind of thought when we talked earlier today about, I believe it was the zero vision kind of protocol with those curb cutouts. I think there's room to add those in to where those accessible stalls are now. The one in the middle is the big eye opener to me. There's no aisle for those two cars. If you're at the very top, the passenger side, you could get out and you're right at the sidewalk. But there's certainly room for improvement on that one. And as far as the curb cutout goes, I think it's more than a curb cutout. It's taking down a fence panel of split rail fencing and putting an actual walkway through the garden, if we are to keep those accessible stalls there. I guess kind of the question is that where the accessible stalls should be, close to the washroom, or do you want them closer to that MobiMat, or maybe it's a hybrid of everything? Right? Maybe it's one or two.
That was actually what I was going to suggest.
Oh, sorry.
Sorry.
That was you, Richard?
Yeah, I was actually thinking that exactly. What if we have like it split so there is a spot near the washroom, but then there's a spot closest to the movie mats?
That's certainly something that we can look into, and I appreciate that feedback. Looking at the map there, my kind of thought right off the bat is in that northeast corner, kind of making one stall right there that's close proximity to that MobiMat. And then another possible option is in the southeast corner, where there's currently 6 stalls there for small cars. That would be another possible way of getting people a little bit closer to beach access. There's a couple of picnic tables there you can see in the aerial shot where you could potentially get to, making it a little bit nicer of a view.
Okay, I do have a speakers list here. I'm going to go to Bay and then Sean and Councillor Armstrong. So Bay?
Hi. Yeah, so I've been down to this area during the summer when there's a lot of people, and there are a lot of children who go running through that parking lot. And it would probably be a good idea to put a trail along the outer edge of that C shape there. I think there's maybe a bit of a ditch there if I remember correctly, but having a paved trail or a hard surface trail that goes around the outside, people could exit their vehicles and walk forward to that safe path and not end up in the roadway there. Another thing I wonder about is if the steepness isn't a big issue, about having that Moby mat closer to that raised crosswalk and the picnic tables there, by installing a pathway, if that would be a practical option, because it would be far more central than going off onto the side path there.
I'm just making some notes here, Bay, so don't mind me. I just want to make sure I get all this down.
And I guess I just had a question before we move to our next speakers. When you say one way in, one way out, is that like you circulate in and you can only go through the drive aisle in one direction?
Correct.
Okay.
Correct. So it would be that second entrance that you see on the screen right now at the far north of the parking lot. You would take your left in right after the raised crosswalk speed bump, we'll call it. You find your parking stall that way, you circle around, you come out at the south entrance, just past the washroom block there.
Okay. Councillor Armstrong?
Yeah, my question's on the small spots, and it came up with Jocelyn earlier. Cars have gotten wider, and we haven't increased the size of our small parking spots. Are we going to look at doing that? Like, I think it's between 2 and 4 inches. Now cars have grown. And the same thing with those that have mobility devices. They're much bigger. The vehicles are bigger to transport them. Are we taking that into consideration when we're making the spots? Because I see a lot of times, cars parked in 2 spots because they don't fit in just one. And that's the small cars.
I'm certainly going to take it into consideration now. It as you can see with the amount of small spaces that we have there, I think that's certainly worth a bigger look there. So thank you.
Yeah, no, I think it's really important because people don't drive small cars anymore.
Thank you. I'm going to go to Sean and then Alexandria and then Richard.
Thanks for this. So our family spends a lot of time on weekends. Our son really loves it there, so we're there like every second or third weekend or something like that, so we're very familiar with it. One of the things I'll start with is that there's never going to be enough parking at Neck Point. It's one of the most popular parks in town. The parking lot is universally almost always full, which leads to us having to go park up at the school and walk down. That road down is treacherous for completely different reasons that have nothing to do with you. So I'm not sure, I think widening the parking spots probably makes a lot of sense, because whether there's 36 parking spots or 30 kind of doesn't make a difference, because it's not going to be enough regardless. So that's that point. Regarding where the spots are, I mean, typically, I guess when I would think about accessible parking, it would be in the spots closest to the service that people want to access. So the least distance between where they are. I don't think people are going to Neck Point to use the washroom. I think the washroom access is an important part, but they're going because they want to access the trails or the Moby mat or any number of things. And so having the accessible parking closest to the places that people are going to go makes sense to me, or at least having some of it there. Yeah, it's a challenging space to try and have accessible parking because it's not a super accessible park. Like, parts of it are accessible, Large swaths of it are not. There's hard packed, but there's also lots of stairs and uneven surface. So anyway, I'm glad this is being done. But yes, I think wider stalls, and I think having those spaces closer to the places where people are actually going. I see those spots down below, which would actually, if they didn't put people right out on the middle of the road, would actually be decent accessible parking if there was some measure there to keep people from getting out of their vehicle and walking into traffic. If they could go out the front and start to access the space, those lower spaces are pretty prime to me. And they are also a little bit closer to the washroom, and they put people out on the beach side, which means they don't have to deal with traffic at all. Thank you.
Thank you. Appreciate the feedback.
Alexandria?
Thank you. I, too, was going to point out that those spots for the small cars down below, they seem to me like a sort of natural spot for the accessible parking as well. For the accessible stalls, the parking lot is a challenge to navigate at the best of times. And I think paving will be helpful, but I don't know if the prospect of a second raised crosswalk closer to the washroom facility, if that may be considered as well. What I've observed is people just walk all over the place, through the parking lot, cross the road. And so if you're wanting to divert pedestrian traffic in a safer way, you would want to, I think, provide a second option to do so. Further, if you do move the accessible stalls down to that bottom section, that would make it easier for those using mobility devices to cross back over to the washroom facilities. And a curb cut, some sort of curb cut access to the washroom facility is absolutely essential. I think that's all I had, but I'm really glad to see that this is happening. I look forward to it.
Thank you.
Richard?
So when kind of envisioning the parking lot, I'm also envisioning it at different times of day. A lot of people go there for the sunsets because it's damn beautiful. But once it gets dark, that parking lot is very hard to navigate for anyone with vision. I'm kind of thinking lighting wise and creating an aisle similar to the last speaker. Thinking, say, for example, at the parking lot at Country Club Mall, there is a raised pathway that goes from the mall to the Starbucks down below, and it kind of goes right in between the parking stalls. If we have some illumination and I don't know, yellow painted pathway that goes through the parking lot, that might clearly direct people who are walking through and make it less of a let's hit the pedestrians in the darkness kind of zone. Yeah, just kind of throwing out that idea, having illuminated pathways with yellow paint to help guide people along a path. Thoughts?
Yeah, thank you, Richard.
So that yellow paint, that would, you're kind of talking about, I know I'm using the wrong terminology here, so I apologize, but it's kind of a wayfinder along the shoulder is what we're talking about, right?
Yeah, in a sense. And that way, it would kind of help direct people, but then also be more awareness for drivers that, hey, someone could be coming along this pathway. And there's two entry points into the park, and we could kind of connect those to those pathways too.
Yeah, no, that makes sense. I'll put that down as well.
Councillor Armstrong?
Thank you. My question maybe could be answered by Linda or Jocelyn, I'm not sure, but we've received complaints over the years from bus drivers as well as from those that do have severe back injuries that going over the humps is extremely painful. and they really struggle with any route where there is the huge raised speed bumps. Can you comment on that? Is there a height that is more recommended for those that do have suffer from back injuries or have issues?
I think that Linda might have more knowledge of the standards on that, but my I mean, other than sharing that that experience myself, I am not aware of any like easements to standards with that in mind. It is a really interesting question, though. And I think a lot of lift-equipped vehicles, lift and ramp vehicles, are very low, and so they are more affected by those speed bumps than I think the average vehicle. So there's a couple of reasons why they can be hard, but also don't, there are also, valid safety reasons for them. So
Yeah, I'm just wondering if that's something again we could look at, because there's a big difference between a speed bump and then the longer humps too, which are nowhere near as high.
Yeah.
And I noticed that the difference between the height on the one on Bruce and the one on Front Street, where you go airborne on Bruce versus Front Street. Thanks.
I'm going to go to Bay and then Linda.
Okay, sorry.
I can speak to that as someone who has chronic back spasms and takes the bus. The smaller speed bumps tend to hit a lot harder than the big long ones. I think people slow down more for them perhaps, and they're more gradual. Whereas the traditional, maybe 1 or 2 foot wide and half a foot tall, it's very jarring and quite painful in comparison to the raised crosswalk that's more subtle slope.
Thank you.
Linda?
Yeah, I don't know, in CSA or the BC Building Code, there might be standards. I agree that the raised sidewalk or the raised crosswalk has much more beveling on the sides if you have to approach it that way. Sometimes speed bumps can be narrower and leave like a little bit on one edge, but then like you're in a street or a driveway if you're crossing a speed bump. But they're also a tipping hazard for wheelchairs. Like you're going up at this incredible angle and then coming down at the same angle. And it's like, I just really struggle in a big power chair to get over them. So I think some investigation into the standards that are emerging, because Accessibility Canada is working on them, and BC Building Code's usually ahead of the game.
Thank you.
So speaking on those kind of raised crosswalks throughout the city, Councillor Armstrong mentioned Front and Bruce Street and feeling a difference between those. Jocelyn and Linda, is there one that you prefer around town, or one that's like definitely a red flag, just so I can make sure that we avoid kind of that design and maybe tend towards something else?
I would definitely say the Bruce one for vehicle, but I would agree with what Linda said, that they are almost all difficult for wheelchair users, particularly manual, but I think powered mobility users have more risks in falling over. But yeah, the sort of short ones, the ones that aren't as flat, like the Bruce one, I haven't had to wheel over that one myself, but the longer ones I think are just a little easier to get over than high centering on the smaller ones.
Sorry, maybe I should clarify that a little bit as well. So obviously, Linda, if I'm hearing you correctly, coming onto the crosswalk, the raised crosswalk itself, that's where the tipping hazards are, where my original question was more about the drivability of a lift vehicle going over it, and someone with a back injury maybe getting jarred as they're going over in a vehicle versus crossing in their chair. Is there?
Yeah, they're two completely different questions, and I don't have a vehicle.
Okay.
So the raised crosswalk on Front, I know, The only danger there is you have to look both ways for the bicycles, and then there's nowhere to stop to look both ways for the cars. But approaching that raised crosswalk, you're level, like you're coming from the sidewalk across. Driving across it, if I were on the street, they're more beveled, so it's easier. And I think Jocelyn's much more familiar with a vehicle. And any speed bump that's just a regular speed bump is hard for any kind of wheeled vehicle.
Okay, thank you.
A place you might want to check is you could check with the RDN bus drivers, because that's where a lot of our complaints come from, and they know all the speed bumps in the city and which cause problems versus which don't.
I'm going to go to Jocelyn and then Sean.
Just clarifying for the speaker, my last point. The ones like the one on Bruce, the like more traditional speed bumps are the worst I find for driving. And I drive a big old minivan, not a ramp or lift equipped one. Well, it is a lift, but it doesn't ride low like most of those vehicles do, and I still really feel it, and it makes all my like van modifications rattle and stuff. So I would say that is the kind that's worse for me in the sort of modified vehicle category. And I have less trouble with the raised crosswalks or those broad speed bumps.
Thank you.
Sean?
Yeah, just an offer. So NACL, we have probably about a dozen of those low-profile vans that are all lift equipped, all very heavy, and we're always cruising them around. So I'm happy to follow up with our staff and see what their thoughts are on those raised crosswalk bumps, see if they have any concerns, and then get back to you with that information if that would help.
Yeah, I'd appreciate that. Thank you.
I wanted to ask about angled parking, like whether it's possible to have some of the spots that are directly across from each other where you have to currently pull in at a 90-degree angle. Like, I think when I've asked about this in the past, it's been communicated that you lose number of spots when you put in angled parking, but I'll just say that it does give me a bit of anxiety, like imagining pulling into some of those tighter spots when you have cars waiting to go through. So I just wondered, can like the 7 spots along the garden there be made angled that might ease some of the congestion there?
Yeah, so I think you nailed it there. We did come up with 2 designs. The angled parking did have less stalls. That said, the feedback today, I think it was Sean saying, you know, it's going to be full whether you have 40 stalls or 30 stalls, you know, making them a little bit wider. Maybe there is something to that. So I don't really have an answer for you quite yet, but it is something that we looked at.
Mm-hmm. Yeah, I mean, it's a constrained, challenging site on a curve. A lot of reasons that it's hard to include that. Councillor Armstrong?
Sorry, I have just one more point, and this came up again, I think it was a couple of years ago. A lot of those wheelchair vans and stuff now have the side entranceways, and there's not enough space for them to go. We're always used to them coming out from the rear. So are we going to look at the fact that you've got the side winders now, where the entrance is off the side of the vehicle? And I know that's a lot of cabs are moving that direction.
And I think we do have the 3 spots along the washrooms. Is the intent that those would be side access?
So
it's not wide enough.
That's how I see it too. Looking at this drawing right now, to me, there isn't an aisle or a curb cut there that would allow that to happen. So as we say, it's back to the drawing board.
Thank you.
Yeah.
Linda?
My copy of the CSA standards won't open, or my BC building code, but they have dimensions built in. You could have 2 aisles painted so that 2 vehicles can share an aisle. The ones on the ends could exit from the sides. But in making a parking spot like that, usually you put 2 parking spots together and do the yellow paint with the angled lines so that vans, whether you're a driver exit or a passenger exit side, can park in them and still have enough room to exit. So it's just about planning the width. And there's ample standards out there to show you how to do that.
Yeah, thank you, Linda. Totally agree with you. And I think where the accessible stalls there are right now, if you look just below that, it does look like there's some room to make those a little bit wider. Now spreading out the accessible stalls across the parking lot. So no matter what you're coming down for the park for, whether it's Sunset Beach, a picnic at Finn, or the Moby Mat, I think there's some options to make things work for everyone.
Well, thank you so much to the committee for all of your feedback, and to staff for bringing this to us at a point where we aren't too scared to go back to the drawing board, that we do have time. So really appreciate it, and it's going to lead to a much better end product that we can all be really excited about and happy to use, because it's
Yeah, I really appreciated your time and all the feedback today. Thank you.
an absolute gem in our city. Thank you for all the hard work. So we have nothing under other business tonight. For question period, I do see a question from a member of the audience. Do I have to answer forms? No, if you have a question about an item on the agenda, then you're welcome to ask it. I'm going to have to limit to 2 questions, just because we do have a hard stop at 6 o'clock.
Madam Chair, if I just may, thank you. Just a clarification that the question period is regarding specific items on the agenda. So consent items, which we don't have any, other business, which we don't have any, and reports. So it has to be on one of the report items. Thank you.
Yeah, I don't want to bombard you with questions, but I'm just very interested in this topic.
Yes, we're gonna, just because we do have the hard stop at 6, so we're gonna just have to be respectful of time, and I'll ask you to ask your question into the microphone there.
Okay. I was just wondering what we can do to improve the healthcare of people with disabilities and their well-being, because I've read a lot about online about, some people get health issues because of their meds, or because of maybe they might not understand how to eat properly. And then the other one was just like, what other parks do you want to make more accessible as well? Are there any other projects that you're encouraging?
Okay, so the first question is on a presentation, and we can't address that because it's a little bit too broad of a question, but really appreciate you asking it, and I think I can continue the conversation with you off mic. But the second question, as far as other parks that we hope to improve accessibility for, we do have a good answer for that, because the council or the committee has a work plan, including a number of parks where we're planning accessibility audits. And Ms. Osborne, I see you ready to speak to this one.
Through the chair, that's exactly correct. Through the Rick Hansen Foundation, we've been able to identify a number of different parks and outdoor facilities that we're looking to enhance accessibility. And the accessibility committee has supported the parks that we brought forward. So I think that those are probably noted somewhere on our website through our minutes, but we could also add them to these minutes as well, probably.
Yeah, if we could add the list for the work plan, that can never hurt to remind us of where our path is.
For sure. Yeah.
And I can certainly follow up with Sonia after the fact as well. So thank you for the questions. And we have Dr. Hoverman has a question as well.
As much, thanks, Chair. And just as much to add to the minutes for the meeting, for those who aren't aware of the Patient Voices Network and Health Quality BC, I would highly encourage anyone who has interest in essentially bringing the intent of this committee to the provincial scale for helping improve accessibility of healthcare across the province. PatientVoicesBC.ca is the way to become a patient partner.
Excellent. Thank you for the plug on that. Okay. I am going to now ask for a motion for adjournment. Moved by Alexandria, seconded by Sean. All in favor? Okay, meeting is adjourned. Thank you so much to the committee and to our presenters and staff for being present today. I really appreciate all your hard work. Happy New Year.